So welcome to today's presentation. We like to do this annual Medicare 101 presentation with our celebrity guest host this year, Maria. My name is Allen Dembski, Vice President of Buffalo First Wealth Management, and we have some other advisors on the call today. But without further ado, just for quick compliance purposes, we are not endorsing, as you can see at the bottom, endorsing this presentation, nor Maria. This is purely for informational purposes. So without further ado, I'm going to turn it over to Maria Schenk from Sheridan Benefits to talk about Medicare.
Thank you, Alan and Kevin, for having me again this year. I do see a couple familiar faces here, so I am happy to be back once again to go over the Medicare information. The presentation here is going to be very brief, to the point, giving you the Medicare basics. Throughout, I'm also going to be touching on some of the new benefits that you are going to be hearing about on TV. I'm sure you all seen the Joe Namath commercial, so we're going to touch on a few of those benefits now that some of them are going to be available here in Western New York. So as we go through the presentation, please feel free to ask any questions you have. This is your time to get the answers you need. If anybody wants to meet one-on-one after today's session to do a deeper dive into the plans that are available, please let me know. You can either contact me directly. My contact information will be on the last slide, or you can always reach out through Kevin and Alan as well. And I want to stop and say I apologize for the answering machine you just heard in the background. The school's doing its normal nightly robocalls. So my apologies. Just to give you a little background on me, I'm not just a pretty face on TV these days. I have been in the Medicare arena now for going into my 19th open enrollment. I actually worked with one of the local carriers here in Western New York for over 16 years before I came to the broker side. As a licensed agent at Sheridan Benefits, I am able to represent all the plan options here in Western New York. So we represent Blue Cross Blue Shield, Univera, Independent Health. That's right. We now represent Independent Health, one of only a few local brokers that have been approved to do so this year. I also represent United, Humana, Aetna, WellCare, and the Anthem prescription drug plans. So those are the plans that I would be able to go over with you on a one-on-one basis, because Medicare is so unique to everyone and everyone's needs are different. So without further ado, we are going to jump into the Medicare here. And for those of you that are already 65, this is going to be a refresher. Those of you that are turning 65, Medicare is the federal health insurance that is offered through the federal government. So upon turning 65 years old, having certain health conditions or having end-stage renal disease or disability for 24 months, you are entitled to Medicare. There are two portions for Medicare, and you'll see the, whoops, we jumped here. The card here is an example of what the Medicare cards look like now, and I do want to point out that they do no longer use your social security numbers. It is this unique identifier for your safety. So the first portion that everyone is entitled to upon turning 65 is Part A. That is your hospitalization. That covers inpatient care, home health care, skilled nursing, and hospice care. With the Medicare Part A, if you or your spouse worked 10 years or 40 quarters, there is no premium to you or the Part A itself. When it comes to the coverage, there is an, excuse me, an annual deductible of $1,484. This is per admission into the hospital. This is one of the main reasons why people pick up additional coverage and don't carry just the red, white, and blue card. With Medicare, if you are in the hospital beyond 60 days, you start paying a per day copayment of $371. So if you have a lengthy stay, I hate to use this example, but it's a true example, and we've seen several people in our family at least go through this. If somebody has been in the hospital for a lengthy stay due to COVID, and they had just Medicare, they could be paying thousands out of pocket, because there are hidden expenses when you're in the hospital too, because anything that would typically fall under medical, like x-rays, lab work, things like that, you're paying 20% on top of these numbers. So this is why we're out here to educate everybody to know what is the good, the bad, and the ugly of just having the red, white, and blue card to help you make the right decision for what you need when it comes to coverage. Now, please keep in mind, these figures I'm going over today are the 2021 Medicare rates. 2022 has not been released yet. As soon as I have those updated numbers, I will share them with Allen and Kevin so that they can get them out to everyone that was on today's presentation. The second part of Medicare, and this is the one that can get tricky at times. Part B is the portion you pay into. For most people, the Medicare Part B rate for 2021 is $148.50 a month. If your income for a single person is over $88,000, or a married couple is over $176,000, you will face a higher income adjusted or an IRMA premium on top of the $148.50. That could go upwards of almost $500 per person if your income is over $500,000 for a married couple. So turn to your trusted advisors that are on this call, and they can help guide you as it comes to preparing yourself for Medicare, because they do look 2 years prior. So if you are looking to get Medicare in 2021, they are looking at your 2019 income. So as your income starts to decrease because you're retiring, your Medicare premium will adjust each year along with it. In addition to the monthly premium, Medicare Part B has an annual deductible of $203 a month, or excuse me, a year. Once that $203 is met, you would then pay 20% of services rendered. Under Part B, it covers your medical, so doctor's visits, lab work, same-day surgery, prosthetic devices, wheelchairs, anything like that's going to fall under the Part B premium. Again, with Medicare, that 20% keeps going and going. It's like the Energizer Bunny. You keep paying and paying through the end of the year. So there is no cap to your out-of-pocket expenses when it comes to original fee-for-service Medicare. Fee-for-service Medicare is somebody that is walking into a provider with simply just their paper, red, white, and blue card. Now, my job is to help you find the plan that works with Medicare and works with the needs that you have. Medicare Advantage, or what's known as Part C, is one option that somebody can pick up to accompany their Medicare. This is the most popular option simply because it works very similar to the plans you've had while you were working. A Medicare Advantage plan basically covers everything your Part A and B covered. There are no medical deductibles, so that $203, that $1,484, that goes away. The Medicare Advantage plan you enroll in becomes your primary insurance, and you pay the co-payments of that plan for the services rendered. So you'll also see that these plans are going to cover you for urgent and emergency care worldwide. So I know as retirement draws into most people's lives, you like to travel more and more. So you don't necessarily have to have a national coverage plan if you're just going to be traveling for short stints. You're always going to have urgent and emergency care. So whether you get have a sprained ankle or a sinus infection or God forbid, a heart attack, you are going to be covered anywhere in the world with the Medicare Advantage plans. Most of the plans will include prescription drug coverage built in. There are a few plans that don't, because there are people that either get coverage through the VA or have a prescription drug plan from their former employer that they wouldn't need it. Most plans now will include things like vision, hearing, dental, and other wellness programs, meaning most of the companies now offer what's called an over-the-counter card. They give you so many dollars per quarter to use on over-the-counter things. So your low-dose aspirins, your vitamins, Band-Aids, cough medicine, you can use that over-the-counter card. It's typically an online service that you order through, and the prescriptions get mailed right to your home. You can also get the Medicare Part B buyback. This is going to be all over the TV within the next few days as Medicare open enrollment really starts to launch. You've been seeing the commercials for the last year. Joe Namath comes on and he gets all this money back in his Social Security check. Well, now your local carriers are going to be offering it as well. The 3 main carriers have introduced plans that do offer those buybacks. I will give you one piece of professional advice. Just because you're getting money back in your Social Security, the only way you can get that is by taking something else away. So you can get a buyback, but you lose, in most cases, your ancillary benefits. So your vision, your dental, your hearing, your gym memberships, those go away in order for you to get that Medicare Part B reimbursement. Most importantly, the Medicare Advantage plans cap your out-of-pocket expenses. So you'll see here that there's an annual out-of-pocket limit for medical services. For this year, it cannot be more than $7,550. So God forbid something catastrophic were to happen, cancer, dialysis, you will never pay more than that $7,550, where if you had just Medicare, you keep paying till December 31st at midnight. So that is one of the major enhancements that the Affordable Care Act of 2010 put in place for these Medicare Advantage programs. No matter what type of program you enroll in, once you're enrolled in Medicare A and B, you will always continue to pay that Medicare Part B premium. With the Advantage plans, there's different types of programs. So you have your HMO, which is your health maintenance organization. These are the types of policies that you do need to use doctors within the explained network from that carrier. So if you pick a carrier and their service area is the 8 counties of Western New York, then your doctor must be in the 8 counties of Western New York and participate with your plan in order to be covered under an HMO. Again, you will have urgent and emergency care worldwide. You just will not have routine care by a non-network provider. PPOs, these are the very popular plans for my snowbirds. So all of you that are lucky enough to leave Western New York during the best season ever, snow season, a PPO plan may be a good fit for you because a PPO plan is going to allow you to see doctors both in and out of the network with no cap on the routine services you get out of area. There's also a hybrid out there called a POS, which is a point of service. Point of service plans will allow you to get limited coverage by out of area providers. So you may be able to get up to $3,000 or $5,000 when seeking care out of area. A PPO does not limit you. There are carriers here locally that have what's called a national network on their PPO. So if the doctor in a given area, so let's say you're down in Marco Island, Florida, or you're out in California, the doctor participates with that network. It's still considered in network for you, so you're going to pay the lower cost share. Typically with a PPO, although there's no limit on what you can have done out of area, there is typically a higher copayment. Private fee-for-service plans, we're not seeing these as much anymore. They used to be, there used to be quite a few of them here locally. Private fee-for-service plan is a plan where the doctor can choose to accept the network at the time of service. So you can go see Dr. Smith today, and he's like, yeah, I'll take your fee-for-service plan. You can go back in 6 months, and they can tell you no, because it is on a as-seen basis as to whether or not the doctors participate, which this is why we're not seeing too many of these. The insurance companies have closed those out because they don't really serve the public very well when they go to their doctor and the doctor's like, we can't see you because we're not taking your insurance today. Medicare savings account plans, these work like your high deductible plans. For those of you that are working and have a high deductible plan with an HSA, it's exactly what this is, but the government funds the HSA for you towards a portion of the high deductible plan for those Medicare savings accounts. And then finally, there's the special needs plans. These are for people that either have like Medicare, Medicaid, or live in a long-term care facility or have certain chronic illnesses. They design plans specific for those people to give them more specialized care, to keep them in the community longer, keep them independent, and keep them going with the proper care that they need based on their needs. Any questions on the Advantage plans before I move into Part D? All right.
If you do have a question, everyone is muted, so just unmute your line. Or you can also go into the text chat and we can answer questions from there as well.
Perfect.
Maria?
Yes.
I have a question about HMOs.
Yes.
My parents lived in Florida and they had an HMO and they paid nothing for their HMO. Is that state designated, or is it typical that you could choose an HMO and it's free?
So that's a great question. So there's a couple parts to that question. Yes, all Medicare Advantage plans are determined by the local service area. So the plans that are available in Florida are probably not available here and vice versa. It is very typical to have an HMO with a $0 premium plan, and every carrier available here in Western New York has one.
Okay, thank you.
So yeah, that's very common. And I will add in there for those of you that have family in other states, through this year, I am now appointed not only in New York State, but I am appointed in Florida, Pennsylvania, and Minnesota as well. So I do have arms in some knowledge of the plans in the other states as well. So if anybody has questions regarding those areas or families, I could help with those as well. Okay. So this is always a fun time for me when it comes to prescriptions, because this is probably the most complicated portion of Medicare and probably the most expensive portion, because Medicare, we all know that prescription drug coverage is not cheap. We see it in the news every day, the rising costs, they're trying to control it. Maybe someday they'll get it right, and Medicare Part D will be enhanced even further. I mentioned in the beginning, I have been doing this since 2003. So I entered the Medicare market well before Part D did. And I'm going to preface it with, back in 2003, health insurance plans only covered $1,250 towards prescription drugs, after which people were on their own. So it has come a long way. Part D is not the fix for everybody, but it is a it's a good enhancement from what people had prior to. So Medicare Part D came out in 2006. And when it first came out, it didn't give a lot of coverage, but what they did is over time, they increased the allowance and they decreased the donut hole. So we've all heard that lovely word, and we're not talking about the delicious treats at Tim Hortons, but we're talking about the infamous gap with prescription drug coverage. Now, one thing I do want to point out with prescription drug coverage, if you don't pick up Part D when you first become eligible or have had credible drug coverage, you could face a late enrollment penalty. So education is key here, because most people, if you're over the age of 65 and you're still working, your employer is required by October 15th to provide you a certificate of credible drug coverage, so that when you do opt to go into a Medicare Advantage plan or a standalone drug plan, you have proof that you have had credible drug coverage so that you do not get that late enrollment penalty, because it could add up quickly. The penalty is 1% of the national average for each month you went without coverage. So right now, the national average is about $43 a month. So you take 1% of that for 43 cents, and you divide that, say, by 36 months because you went 3 years without coverage, that can add up quickly. That is a lifetime penalty. Once it's assessed, it doesn't go away. So that's why we want to make sure that you guys have all the information on this so that you know what to look for from your employer if you are over the age of 65 and still working, and that you have that piece of paper saved in a little special spot with all your important paperwork so that when the time comes, you have it to pull out and show to the healthcare provider that you are opting to enroll in. So I think the max penalty right now, if somebody went without Part D coverage and they had Medicare back to 2006, it's about $70 a month extra that they will pay for their lifetime. This is where Medicare Part D gets really fun because there's 4 phases. And this is where I really take pride when I sit with my clients, because I will get a list from you of all your medications. I will run a report so I can tell you approximately when you are going to hit each of these coverage periods. So right out the gate, if your health plan has a drug deductible, most plans have a deductible if you're on the higher tier drugs, 3, 4, or 5. Once that deductible is met, you then pay the cost, the copayment associated with your prescription until you reach the initial coverage limit, which is $4,130. Once your total drug cost, that's what you pay and what the insurance company pays combined, reach that $4,130, that's when you're in the coverage gap or the donut hole. This is where you will pay 25% of all costs of your medications. So let's say you are on a tier 3 drug that costs $400. You're going to pay $100 at the pharmacy, but because it's a brand name drug, the total drug cost is going to go towards your out-of-pocket. The out-of-pocket maximum for the prescription drugs is $6,550. So anything you've paid in the initial phase, so let's say you've paid out $1,000 to keep it simple. You enter the coverage gap. Now your out-of-pocket is down to $5,550. You go and you get that $400 drug, that comes off of the $5,550. But if you're going to pick up your atorvastatin and it's going to cost you $2.20, just the $2.20 you pay, not the cost of the drug, comes off of that final number. So this is really where we come in handy because, again, we will run a report for you. We'll put all the drugs in the system. We'll find the plan that we think is going to work for you. We plug in your drugs and we give you a report. The report breaks down the prescriptions over 12 months. It's going to tell you what the copayment is. It's going to tell you if and when you're going to hit that coverage gap. And when you do, it's going to tell you what that rough out-of-pocket is, that 25%. So you will have a big picture of what your prescription costs are going to amount to when you are looking at that report. Because this Medicare Part D has so many phases and so many people can hit that coverage gap, there is help available to you that you can apply for. The first one's going to be the New York State EPIC program. This is for any individual that's 65 years of age or older, lives in New York State, and meets the income guideline. So a single person can earn up to $75,000. A married couple can earn up to $100,000. What EPIC does is that it could lower your monthly premiums as well as your prescription drug costs. If you're somebody that we know will get in that donut hole, Epic can help offset that cost. Under Epic, your prescriptions are no more than $20 for up to a 90-day supply. For those that were in the military, we always say, if you've served and you've done your duties, by all means, contact the VA and see if you qualify for any services through them as well. A lot of people can get their prescriptions as little as $8 through the VA. And then there's a low-income subsidy through the government. Once you apply for Medicare, everybody gets this application in the mail. It is a 4-page application. It's like a mini Medicaid application because they really want to know what your true income is, what your assets are, to help determine if you qualify to receive any extra help through the government paying for your prescription drugs. Again, the Part D is probably the most complicated part of choosing the health plan because the costs are so high when it comes to prescription drugs, but we will do everything we can to help you. Again, I've been doing this a long time. I have a lot of connections through different programs. I actually have family members that got me hooked up with the MS Society, and we've saved clients thousands of dollars through grants to get their MS drugs. We have contacts over at the Alzheimer's Association. So we do have contacts throughout Western New York to help when it comes to prescription drug costs. So we're always going to look for resolutions for you to enhance your healthcare needs and try to get it to you at the lowest possible out-of-pocket cost. Any questions, confusion on Part D?
I got something. I am completely surprised that the income eligibility is not double for married as it is almost everything else. Can you just touch on the advantage of, I don't know if this is further on in your presentation about enrolling into Epic, then there is another advantage to doing that.
Yeah, so with Epic, I'll do the deep dive now. With Epic, there's actually 2 programs. There's the fee plan. So anybody that's single that earns less than $23,000 or a married couple that earns less than $26,000, you would pay an annual fee to Epic. In turn, Epic will pay the drug portion of your premium. So that's another way that you could get a plan that costs no money at all, because Epic will pay the drug portion of the plan. So if it's less than, I think this year it's like $43.80, Epic will pay that for you. Then on the fee plan, Epic will go right into co-payments. So you will pay $3, $7, $15, or $20 for your medication. And again, those co-payments are for a 90-day supply. If your income is $23,001 to $75,000 single, $26,001 to $100,000 single, you would have to meet an annual deductible for the Epic plan. Now, it's money you're already spending. So when I tell people, oh, you're going to have a deductible, they're like, I don't want to spend any more money. My drugs are expensive enough. That's the beauty of this program. It's not going to cost you anything. The dollars you're already spending on your prescription drugs are going to satisfy your Epic deductible. Once that Epic deductible is met, then you too will get those co-payments of $3, $7, $15, or $20. So anybody I sit with, if their income meets the criteria, I advise everybody to get into it, because there's a hidden secret for Epic members. Any Epic member can change their plan one time each calendar year outside the annual enrollment period. So it falls under a special election. So we tell everybody, all Epic members are special. You can change one time outside your annual enrollment period. So God forbid something catastrophic happened, you will be able to change your plan for the first of the following month. I actually just had this happen about 2 weeks ago. Had a client call me, healthy as can be, goes for his annual physical, gets diagnosed with prostate cancer. 2 weeks later, he's having chemo and radiation. So he was on a $0 HMO plan. For the first of the following month, we switched him to a Medigap policy. I'm going to get to those in a couple of slides, and you'll see why we switched him to that plan. But we can definitely, as diagnoses come up, we can reevaluate. Epic can be enrolled in at any time. There is no open enrollment period for Epic. The only thing you have to keep in mind is you cannot enroll until your 65th birthday. They get it the day before, they will deny it and have you submit a new application. So I tell everybody, birthday gift to yourself, put your Epic application in the mail.
Thank you, New York.
Yes. It wouldn't be New York if it was easy to do.
Maria, it's
Yes.
Marie. So what happens if your income is higher than those things?
Unfortunately, you will not qualify for the program. And that's when we start digging into all the other grants and programs that are available in the area. So if you have a high cost medication and you don't qualify for any of these programs, we don't just say, okay, you're on your own. We'll help you find help through them. A lot of times we can go right to the pharmaceutical company and apply for the patient assistance program. And that alone will alleviate a lot of the cost, because what they do is based on your income, they will reduce your cost share. So they'll run everything through your Medicare Part D first, and then they'll discount your cost share based on your income.
Maria, one more question. What counts as income? Does Social Security count as income, pensions?
Yes, it does. So it's your Social Security, any earned income from a job, any pension distributions, any 401k distributions. So I'm specifically saying distributions because they don't care what's in the bank. They don't care what's in the mattress. They don't care how good your 401k looks. It's just what you're physically getting each year. Anything that's filed on your New York State tax return as taxable income is what Epic looks at. So like if you have income property, pensions, distributions, 401k distributions, that's what they look at. And it's actually on the application spelled out line by line as to what you have to claim. And because it's New York State doing this, they actually bump it up to your tax returns to verify your income. So they can verify your income electronically thereafter every year.
Thanks. Thank you.
You're welcome. Any other questions on Epic or Part D?
I'm just going to throw this out here, Maria, because that's actually a good point. When it comes to IRA distributions, the Secure Act actually extended that to age 72. It's not 70 and a half anymore, it's 72. So if you're not taking retirement assets, let's say you apply for Medicare at 65 and you're waiting until, and you're not taking your IRA distributions, but at 72, you have to, that could have a tremendous effect on these eligibility requirements for a lot of these social programs that are out there, where it might bump you out of eligibility later on once you start taking RMDs.
And this is why we team up to get this done right.
Can I ask you about the prescription stuff?
Mm-hmm.
From the past, I'm on Medicare, so I understand a little bit about it. The different costs, the tiers, how do they set that up?
That is
because it looks like every
question.
company is a little bit different.
They are. So what Medicare did was Medicare set a standard that there's 5 tiers. Tier 1 are your low cost generic drugs. That's typically any medication that you can walk into the pharmacy and get on their $4 programs. Tier 2 are your non-preferred generic. So those are your higher cost generic drugs or combination drugs. Tier 3 are your preferred brand name. Those are brand name prescriptions that have no generic alternative or are used for a unique purpose.
So how is it that I had a prescription that was a tier 2 a year ago? It is a tier 4, it's a generic.
Yep.
So how did they do that?
there's a couple of reasons why that can happen. A lot of times there are prescriptions that at a certain age are no longer considered safe.
Oh, no, that's not one of them.
Okay, I'm answering your question. So there's drugs that at a certain age are considered unsafe. So they do move those to the higher tier because first, the risk sometimes, or the benefit sometimes outweighs the risk. The other one is the cost of the drug could determine. So there are generic drugs that are both in tier 3 and tier 4 categories, but because of the cost, they've been bumped up.
What I've noticed that not all the companies are the same. Some of
They are
them are
not.
still at number 2 and some are in number 4.
Correct.
So what I did, just to let people know, I would have had a $290 deductible
Mhm.
plus $94 a month for this particular drug. I went into GoodRx,
Mhm.
got their thing, cost me $146 for 90 days.
Yep.
Did the math, saved a lot of money.
Yes,
So there are different
GoodRx is
options.
always a great alternative for those brand name drugs. But to your point, each insurance company has their group of doctors, pharmacists, and clinicians that categorize their medications. So yes, it's not uncommon to have a drug on a tier 1 or tier 2 with one company and a tier 3 or tier 4 with another. And they can be two very, very similar and competitive companies, but yet have very drastic differences when it comes to their formularies. A lot of times too, if the insurance company has what they call an enhanced formulary, they sometimes have more options on the lower tiers than the higher tiers. So if that particular company you're referring to has an enhanced formulary, that could be why it's still a tier 2 with them too.
Okay, that's why it's important to look at these things every year.
Absolutely. My phone's been ringing off the hook with my current clients and they're like, should I just stay where I am? Well, maybe, but we still need to look at everything. Never just assume it's going to be the right fit, because unless you read your annual notice with a fine-tooth comb, there could be something you're missing and possibly losing towards the next year. Now, I will say this. If you are on Medicare already, if any of your medications are going to change tiers, or if any of your doctors are no longer going to participate with your current plan, you will be notified in early November. So keep that in mind, because they have to give you 60 days notice if something's going to change. So I point that out because a lot of people say, well, I already made my choice, I can't change again. That's not the truth when it comes to open enrollment. You can make as many changes as you want, but the last application submitted counts. So if every single day between October 15th and December 7th, you want to change your plan, you can. The one that goes in on December 7th is going to be the one that sticks.
Okay, thank you.
So you're welcome. Because I had somebody that missed that last year and thought they couldn't change, but you actually have options during the annual enrollment. You can make many changes, and again, last app in counts.
So that actually would apply the same thing for the following year if you have Epic. You can make that change?
Correct.
Okay.
Yeah, because it's not uncommon. It's less common now than it was in the beginning when Part D came out, but it's not uncommon, like especially if a drug goes generic. So if a drug, like when Lipitor came out and atorvastatin hit the market, after 90 days of Lipitor being generic, it moved to that tier 4 drug because there was the low-cost alternative, atorvastatin.
Okay.
So all the people had to be notified that if the doctor wrote it, dispensed as written for Lipitor, they would be now paying a tier 4 drug instead of a tier 3. So they
Big
will
difference in cost.
Yes, there's a huge increase in cost. Like, people tell me all the time, I take the brand name Synthroid. Well, Synthroid's a tier 4 or a tier 3 on most formularies because it is brand name. Not very expensive. It's about $60 a month. if you were to go to the pharmacy and buy it outright. But there is levothyroxine, which is in most cases a $0 copayment on most plans. So, you know, we're not doctors, we're not pharmacists. We can't tell you what prescription to take. We can help you Google generic names and tell you to talk to your pharmacist or doctor. We can't change your prescriptions, but we can help find lower cost alternatives when possible when it comes to your medications.
Maria, Arlene has a question, but I think you're going to answer it in a minute. Do I have to enroll for Medicare when I turn 65? And I think that is coming up in a minute.
It's going to be in here, but I will answer that.
Okay.
What happens is when it comes to, this is actually perfect timing because we're talking about enrolling in Medicare. So for people that are 65, do you have to enroll in Medicare? Not necessarily, but what I want to say is this. If you were somebody that opted to take Social Security early, so let's say you retired early and at 62, you said it's worth it, I'm going to take my Medicare. Anybody collecting Social Security will automatically get their Medicare card in the mail. If not, you have to apply on your own. So this is what you have to look at if you need to enroll or not. So if you turn 65 and you are still working, if your employer has less than 20 employees, you do need to take out your Medicare Part B for several reasons. One, if you don't take it out and the employer is under 20, you will face a late enrollment penalty of 10% for every 12 months you go without Medicare Part B. Okay. Second, your health insurance carrier can deny your first 80% of your claims because when your employer is under 20, Medicare is your primary insurance. And I will tell you with COVID and the amount of healthcare increase the carriers are seeing this year, we are seeing the audits happening left and right, where I get a phone call saying, I got all these bills from my doctor from a year ago. Why am I getting these bills? Well, when we peel back all the layers, it's because they never took out their Medicare because they thought, oh, I have group health insurance, I don't need Medicare. So it comes down to how many employees are at your job. Under 20, you have to take out Medicare. Over 20, as long as you're not on disability, you do not need to take out Medicare. If you or your spouse is disabled and on a health insurance plan through the other spouse's employer, there must be 100 employees in order for you to decline your Medicare. So straight Medicare due to 65, and there's more than 20 employees, you do not have to take it out. So for example, if you are employed with MOG, and they have hundreds of employees, thousands, and you turn 65 and you're going to continue to work, you do not need to take out your Medicare Part A or B because the government says you have a large employer group, that's considered credible, it's better than what we can offer you. Some people will opt to enroll in Part A, and that's okay. But there's always a but, isn't there? If you are contributing or participating in an HSA account, a health savings account, you do not want to enroll in Medicare Part A. As soon as you enroll and your Part A is activated, you nor your employer can contribute anymore. Okay, so if you are working for that large employer group, you have a high deductible plan and an HSA, you don't even have to touch or enroll in Medicare at all until you're ready to retire. What will happen when you're ready to retire is your employer will fill out what's called an employment verification form. That is telling the government that you have had credible health insurance coverage since you turned 65. That will waive the Medicare Part B late enrollment penalty. What's true for you is also true for your spouse. So if you are the one that holds the health insurance and your spouse is turning 65, that holds true for them too. It doesn't have to be through their employer. So I'm an employee at Moog. I cover my husband. He turned 65 before I do, but I'm still working. He doesn't have to take Medicare. When I go to retire, my employer will fill out that form for both him and I, indicating we had coverage through my employer. Okay. Does that
Maria?
answer your
About,
question?
Actually, I just want to add this to it. So I'm a recent widow. My husband died last year,
Mhm.
and I'm getting a percentage of his Social Security.
Mhm.
I turned 65 in May.
Yep.
I am not going to take my Social Security till I'm 66 and a half or something, because that's when
You're-
I can get the
Your full
maximum.
retirement. Mhm.
Yeah.
You will still
So
get a Medicare card in the mail 3
I will.
months prior. Yeah, so in February,
Yeah.
your Medicare card will show up because you're receiving benefits, even though they're his, they're
Yeah.
spousal benefits, you're still in the Social Security benefit system.
Okay.
So your card will automatically get mailed to you in February. Are you still working?
I work for myself, so my
Okay.
insurance comes through the marketplace.
So then you do not want to decline the Medicare.
Okay.
And I
Okay.
will tell you, I am certified through the New York State of Health as well. Medicare will be more cost effective for you.
Okay. So will I automatically get a card that covers Part A and Part B, or I have to
Yes.
apply for Part B?
No, because you're in the system, in February, you're just going to wake up one morning, go out to the mailbox, find this pretty little white envelope with your Medicare card in it. It's going to have your Part A and Part B. It'll show effective for May 1st. That's basically telling you that you've entered your initial enrollment period, which is a great caveat to this next slide. Your initial enrollment period starts 3 months before your 65th birthday, the month of, and up to 3 months after. So you have a 7-month window to enroll in a Medicare Advantage plan. And then once that 7 months has ended, you're then locked, what they call locked out, until the annual enrollment period, which runs October 15th to December 7th each year, unless you have New York State Epic, then you're special, and you have a qualifying event one time throughout the calendar year. So yeah, no matter what Social Security you're getting, whether it's spousal or your own, you will automatically get your card. If you're not working, or if you are working and you're not drawing any types of Social Security, that's when you would have to begin the process on your own. Now, since COVID, the Social Security offices do not see anyone in person unless there's like some dire need. So the easiest and most effective way to enroll is through the Social Security website. So if you have not set up an account at ssa.gov, I would highly recommend everyone doing it. I will tell you, I did it about 3 years ago and I found 2 zeros in my income. And let me tell you, that was an act of Congress to get fixed. So always check your income, because they take your 35 highest grossing years to determine what your payout is. So if I can make one recommendation to anybody, is just get yourself an account set up so that when the time comes that you need to enroll in Medicare, you literally scroll down and it says, congratulations, you're eligible. Would you like to start your Medicare application? It takes approximately 10 minutes to fill out the enrollment form online. And then usually you have something in the mail within 3 to 4 weeks after you do it. I would recommend, if you are going to apply for Medicare to start the first of the month you turn 65, you do it a minimum of 2 months before. So right now, if I wanted coverage for January, this would be a good time to go on and enroll, because right now the system is going to start getting overloaded due to the fact that we are in the open enrollment period. Lots of people are opting to retire at the end of the year due to COVID situations. So it gets tied down. So your 3 to 4 week wait period could be anywhere from 4 to 8 weeks. So you want to give yourself ample time so that you can get coverage as of the first of the month. Anyone needs help doing their Social Security enrollment. I'm happy to meet with you, have you log into your account and assist you with walking through that application. Like I said, the hardest part is setting up the account, coming up with a username that they like and will accept, and answering your verification questions. So once that's done, the enrollment process gets really easy. Okay.
Maria, I have
yeah.
one other question,
Yeah.
in addition to what you said. So if my Medicare A and B are automatically, that card's going to come to me, do I need to make arrangements for the C and D part?
Yes, that does not come automatically, but I will tell you what is automatic. Your disenrollment from the New York State of Health as of the last day of the month, you turn 65.
Okay, thank you.
So yeah, that's automatic. It's triggered by your birthday. And if they see that you're turning 65, they do send you a letter telling you that your coverage is going to end the last day of the month that you turn 65. So yeah, and I always tell everybody, 3 months before your birthday, if you want to start looking into the different plans, that's usually a good window. So feel free to give me a call in December, January, or December, January, February, anywhere within that time frame, and we can do a full on review of all the options, look at what's going to work best for you, kind of compare it to what you have through the marketplace. If you're on a high deductible plan through the marketplace, you will be pleasantly surprised when you see a Medicare Advantage plan, because it is first dollar coverage. So you don't have to pay that anywhere from $600 to $8,800 deductible. Now, if I haven't overwhelmed you or confused you enough, I'm going to throw one more plan in the mix. So earlier on, I was telling you about this Medigap policy. Medicare supplement or Medigap policies are a second type of plan that you can get to go with your Medicare. These plans are secondary to Part A and B. So your A and B are primary, the supplement is secondary. These do not include prescription drug coverage. So this is where you would pick up a standalone drug plan. Again, you're still paying your Medicare Part B premiums, and these only cover the services that original Medicare covers. So things like a routine eye exam, routine hearing exam, those aren't going to be covered because Medicare doesn't cover them. Where these really come into play is that depending on the plan you go with, you may have to meet your Part A or Part B deductible, but then everything is covered in full. So somebody that may have dialysis, chemo, injectable drugs, these plans could possibly be more cost effective because you're going to pay a little bit more upfront, but then at the time of service, your cost share goes down. So depending on what the need is, this may be a viable option. It's this one here, I will tell you, is the best plan option if you want no network. So if you're a world traveler and you want to go all over the US now that you've retired and you want to be able to seek services in any state you're in without question, this is the policy. Because as long as the provider takes your red, white, and blue card, they will accept your health insurance card. There is no network when it comes to supplement plans or Medigap policies. Okay. Are there any other questions that I can answer?
Is there a cost for that, for the Medigap?
Yes, the Medigap policies run anywhere from $86 a month to over $400 a month. Where an Advantage plan is going to run from $0 to $200. And you get all the ancillary services and drug benefits built in. So that's why, when we sit down, I look at how, I'll ask you, who are your providers? How often do you see each of those providers? And we will look at it and kind of do a deep dive to see what is your monthly out-of-pocket cost based on how often you're seeing these doctors. If your monthly out-of-pocket costs are far exceeding the premium of a Medigap policy, we're going to lean that way. But if you tell me, well, I see my primary doctor 3 to 4 times a year, I got 2 or 3 specialists I see once a year, it's not going to behoove you to go with a Medigap policy because you're going to pay a lot more than you need to right at the moment. And again, every year you can change the plan. Every year they come out with these new and unique benefits. So again, you're going to see the commercials ramp up. We're just, we literally just launched Medicare open enrollment on October 1st. And, you'll start hearing more and more about the buyback. You're going to hear more and more about meals after being in the hospital. You're going to hear about non-emergency transportation. These are all benefits that are now available here locally that weren't when the national commercial started. So I'm here to help guide, answer any questions. I cannot tell you what plan to pick. I can just simply provide you guidance and all the options that are out there. So again, currently we are appointed now with all the carriers that are available here in Western New York. So if anybody did want to do a plan comparison, let me know and I'm happy to get that scheduled for you.
Also for reference, I threw in there the ssa.gov hyperlink so you can create an account. I put in there the link for the Epic website. And finally, I put in there the link for the Center for Medicare and Medicaid website, which both the SSA and the Center for Medicare and Medicaid are U.S. government websites. So make sure for safety purposes that you see that official website in the corner of the American flag. And so you're not clicking on something and putting in your information on a third-party website. So those
there's
are
a lot
the
of
links
those.
there.
There's a lot of those baiting websites out there. They used to only be for the New York State of Health, but we have found ones that are for Medicare too. So Medicare has a great website, which is medicare.gov. Do not put in medicare.com. That is a national broker. That's the one you're seeing on TV, but medicare.com actually, or medicare.gov, excuse me, the government site actually has a plan finder. And for the first time in about 5 years, they actually had it up and running on October 1st. So if anybody does want to go out to the medicare.gov website, you can hit Plan Finder. It'll ask for your zip code, and you can actually pull up all the plans and benefits here in your local area. I'll throw that in here for everybody.
And I put Maria's email address and her phone number in here. If you want to reach out to her, you certainly can. Thank you very much, Maria, for taking your time on a Tuesday night to spend with us and our clients. We truly appreciate it. This will be recorded. If anyone wants a copy of this recording, we will send that out to you after we add our disclosures at the end here. With that, thank you, everyone. Have a great night, and we'll see you soon.
Thank you.
Thank you, everybody.